Good day, students. As a continuation of the discussion that we have for the carbohydrates, we will have now the methods of glucose measurement. So for the learning objectives, at the end of this lesson, you are all expected to describe the principal specimen of choice and the advantages and disadvantages of glucose analysis methods, and also identify the diagnostic criteria for diabetes mellitus, and lastly, relate expected laboratory results and clinical symptoms to the diagnosis of diabetes mellitus. Why is there a need to measure glucose? So we have two general reasons for that one. So the first one is to diagnose and manage diseases affecting glucose metabolism, particularly in diabetes mellitus and gestational diabetes. So we have discussed this in our previous topic, wherein in these cases, the glycemic targets have to be clearly defined in order to prevent the complications of diabetes. So there should be a regular monitoring of blood sugar levels of the patients, and also the patients should have a strict compliance to the treatment regimen suggested by his or her physician. Another one, to monitor the effects of certain medications. So this is already part of TDM, or therapeutic drug monitoring, particularly to monitor the insulin therapy of the patient. So we have to remember that the aim of insulin therapy for patients who have diabetes mellitus is to keep the blood glucose to normal as much as possible. So for patients who undergo insulin therapy, the insulin level should also be monitored, because in cases of insulin overdose, the patient might not only experience hypoglycemic attacks but also the potassium in the blood could decrease, because that is one of the major consequences of insulin overdose, the hypokalemia. For glucose analysis, the standard clinical specimen is a venous plasma, and there should be a fasting period of about 8 to 10 hours, and this should not exceed 16 hours. So that is the recommended time of fasting. Meaning to say, the patient should not eat anything, but he or she can drink little amount of water. So we call that as NPO, or this is nil per os, or otherwise known as non per orem. So it's a Latin phrase that translates literally to English as nothing through mouth or nothing by mouth. And also, the fasting blood glucose must be obtained in the morning after this period of fasting, because there are studies that indicate that the plasma glucose values have a diurnal variation. So usually, it's higher in the morning than in the afternoon. So diabetes in patients tested in the afternoon may be missed because of this variation. And we can also use other specimens such as serum, whole blood, and other body fluids like CSF, synovial fluid, urine, and serous fluid. And for serum, we can use this one as long as the cells are separated from serum within 30 minutes. So just to prevent glycolysis to happen. And also, the estimation of whole blood glucose are usually 10 to 15% lower than plasma glucose alone, because plasma has greater water content than the erythrocytes, and therefore exhibits higher glucose levels than the whole blood. And next one, the glucose is decreased by 7 milligrams per dl per hour if the specimen is kept unrefrigerated. But if refrigerated, glucose is decreased by 2 milligrams per dl per hour. And for CSF sample, okay, we obtain this one through a lumbar puncture, or what we call as the spinal tap. And we have to take note that the CSF glucose concentration is approximately 60 to 70% that of plasma concentration. So meaning to say, if you have a 100 milligrams per dl plasma glucose, then the estimated CSF glucose is about 60 to 70 milligrams per dl. And also, the CSF glucose should be obtained 1 to 2 hours before the spinal tap or lumbar puncture. So this is a medical procedure performed by a physician in which a needle is inserted into the spinal canal most commonly to collect CSF for diagnostic testing. So in this case, for the diagnosis of diabetes or to check for the blood glucose level of the patient. So for glucose analysis, we use the gray top tubes. So this tube contains potassium oxalate as an anticoagulant, so that prevents clotting, and also it has sodium fluoride as a preservative or additive. So actually, this is the one that prevents glycolysis to happen. And 2 milligrams of sodium fluoride per ml of whole blood prevents glycolysis for up to 48 hours. So what is the action of this sodium fluoride? So this fluoride present in the gray top tube will bind to magnesium. So this binding will now cause the inhibition of the enzyme enolase. So remember, this enzyme is the one catalyzing certain reactions in the glycolytic pathway. So once this enzyme is inhibited, then glycolysis will not happen. Now, let us have the chemical methods for blood glucose analysis. So we have here the classic or the oldest method, the copper reduction method. So the test is based on the principle that substances that reduce copper sulfate, so this one, to cuprous oxide in the presence of an alkali or heat will produce a color change. So that color change now will confirm the presence of glucose. And we also have two different methods here of copper reduction, the Folin-Wu and the Nelson-Somogy. So the Folin-Wu, take note, it measures reducing sugars. But your Nelson-Somogy, specifically, it measures glucose. Another one, the Folin-Wu uses tungstic acid to remove the protein from serum. So it produces a protein-free filtrate, whereas your Nelson-Somogy uses zinc hydroxide to remove that protein interferences. So this one shows the differences of Folin-Wu and Nelson-Somogy. So again, for the principle of the copper reduction method, the glucose and other reducing sugars present in the specimen will reduce the copric ions present in the alkaline copper reagent to cuprous ions. Or we can also see in some of the references that the copric sulfate, to be specific, is converted into cuprous oxide. So it will now reduce the phosphomolybdate acid or the phosphomolybdic acid into phosphomolybdenum blue, or the arsenomolybdate into arsenomolybdenum blue. And usually, this one is measured at 420 nanometers. We also have the neocoprene method, which also utilizes the copper reduction principle. So this one produces yellow to yellow-orange complex. And the next one, we have the classic Benedict's method or the Benedict's test. So this was an early method used to detect glucose present in the urine sample. So this is a very easy procedure because we just have to put approximately 1 ml of urine sample in a test tube, and then we will have to add Benedict's reagent. So that is a copper sulfate reagent, and then we have to mix that one and heat the solution in a boiling water bath for about 3 to 5 minutes. And after that, we will observe for color change in the solution of test tubes or any precipitate formation. And this will be now the interpretation. So if it remains color blue, then there are no sugars or glucose present. If it is green or having a yellow precipitate, then there are traces of reducing sugars. For orange-red precipitate, meaning to say there are moderate reducing sugars, and for brick-red precipitate, then it's an indication that a large amount of reducing sugars are present. Aside from the copper reduction method, we also have the Hagedorn-Jensen method. So this is the principle. So the potassium ferricyanide here is reduced to potassium ferrocyanide when heated with alkaline solution by this reducing sugars. So the ferrocyanide form now is precipitated as potassium zinc salt. So that's for the Hagedorn-Jensen. We also have the condensation method or the O-toluidine method, or we commonly call as the Dubowski reaction. So in this principle, the O-toluidine in a hot acidic solution, this one, will yield a color compound with an absorbant maxima usually at 630 nanometers. And also, we have these substances like your galactose, this one, aldohexose, and also the mannose. So these substances, they react with O-toluidine, and they will produce a colored compound that will interfere with the reaction. So in short, they could produce false positive results in this case. For the enzymatic method, we have the GOD, or the glucose oxidase method. So this is not considered as a reference method because it is very specific. It measures only, or it reacts only to beta glucose, and also it is commonly affected by interferences such as oxidizing and reducing agents. And for the principle now, this glucose oxidase catalyzes the oxidation of this beta glucose present in our plasma into D-gluconolactone. So this one. So D-glucono-1,5-lactone. So it's the GOD that will catalyze the oxidation of this beta glucose to this substance. So there will be now a formation of hydrogen peroxide. And the lactone here will then slowly be hydrolyzed to gluconic acid. So that's why you have gluconic acid and hydrogen peroxide formation in the presence of glucose oxidase. Next one, the hydrogen peroxide formed, or the hydrogen peroxide produced in here, is then broken down into oxygen and water by another enzyme, the peroxidase enzyme. So this H2O2 will be broken down into oxygen and water by the enzyme peroxidase. And what will happen now, the oxygen formed here, will react to an oxygen acceptor such as an O-toluidine. And that reaction of oxygen to the oxygen acceptor will convert these substances into colored compound, and the amount of which can then be measured colorimetrically. So that is for the enzymatic method using the glucose oxidase enzyme. Another enzymatic method used for glucose analysis is the use of enzyme hexokinase. So this was developed by the American Association for Clinical Chemistry, and it has been accepted as the reference method for glucose determination because this is not only sensitive, but it is also highly specific with lesser interferences, unlike your glucose oxidase. It is specific because of the secondary enzyme reaction, so you will see it later. And also, this is a type of phosphorylation reaction, so it needs the presence of ATP. And unlike your GOD, this measures both the alpha and the beta glucose. So here's the principle of the hexokinase method. So the enzyme hexokinase, this one, catalyzes the reaction between the glucose in our sample and the ATP to form the glucose 6-phosphate and of course ADP. And what is measured here is the increase in NADH concentration. So the increase in NADH concentration is directly proportional to the glucose concentration. And we can measure this using a spectrophotometer, usually at a wavelength of 340 nanometers. So for glucose measurement, we have just some important points to remember here. So first, the glucose in the solution or in our sample exists as either alpha or beta glucose. The alpha glucose is approximately 35%, 65% for beta glucose. And again, GOD or glucose oxidase is specific to beta glucose. And another one, this alpha glucose is converted to beta glucose by an enzyme known as mutarotaze. And another thing, for the hexokinase method, we just have to avoid vitamin C or uric acid, especially if the patient has high uric acid, that will cause decreased glucose concentration if we are using hexokinase method. Now let us have the different laboratory tests that are used to measure the glucose concentration in a patient's sample. So we have the FPG or the fasting plasma glucose, or the FBS or fasting blood sugar. Another one, we have the RBS or the random blood sugar, and the CPG or the casual plasma glucose. Another one, we have the 2R postprandial blood sugar. So first, for the FBS, again, I have mentioned this earlier, that there should be no caloric intake for 8 to 10 hours prior to test. So again, the patient should not eat or drink any juices, coffee, milk, except water. So for at least 8 hours before the test. And again, this test is usually done first thing in the morning before breakfast because of the diurnal variation of the fasting plasma glucose. Another one for the RBS, so it's any time of the day regardless of the meal intake. So specifically for the RBS, it's ideally collected 2 hours after eating. So that's the usual protocol in the hospitals. But for CPG, to be specific, this is the one that refers to any time of the day regardless of the meal. So the casual plasma glucose. And simply, the 2-hour postprandial test is done 2 hours after meal. So blood specimen will be collected from the patient 2 hours after eating. Other tests also include HbA1c, fructosamine glycated serum protein, and oral glucose tolerance test. So first, for the HbA1c. So this is otherwise known as glycosylated hemoglobin. So this glycosylated hemoglobin reflects the average blood glucose concentration for the past 6 to 8 weeks or 2 to 3 months. So in short, this is a long-term monitoring of blood glucose concentration. And these numbers correspond to the lifespan of our red blood cells, which is also estimated to be about 120 days. And this glycosylated hemoglobin does not need fasting, unlike your fasting blood sugar and the oral glucose tolerance test. So this one, this will reflect the amount of glucose that is bound to the protein inside of your RBC. So the protein inside of the RBC is what we call as the hemoglobin. So when the hemoglobin picks up the glucose from the bloodstream, the hemoglobin now becomes glycosylated as the glucose bind to that hemoglobin. That is why we call it as HbA1c. And since our RBC has a lifespan of 120 days, then that glycosylated hemoglobin will stay in our red blood cells for this amount of time until that RBCs are sequestered by our spleen and our reticuloendothelial system. So this is for your HbA1c. And another thing, the HbA1c should be performed in a laboratory using a method that is NGSP. So NGSP certified and standardized to the DCCT assay. So the meaning of this NGSP is National Glycohemoglobin Standardization Program, and standardized to DCCT, the Diabetes Control and Complications Trial. So that is for your HbA1c. Another one, for the fructosamine glycated serum protein. So this reflects the mean glucose for 1 to 2 weeks. So this is used for gestational diabetes monitoring. So it's shorter as compared to the glycosylated hemoglobin. Another one, we have the oral glucose tolerance test. So this one, the patient will also need to fast, just like in the fasting blood glucose test. So the patient has to fast for 8 to 10 hours. Then the moment the patient arrives in the laboratory, a fasting blood sample will be drawn to the patient. And after which, the patient will be given a glucose load, which will be measured after 2 to 3 hours. So for the diagnosis of the diabetes, we usually use the 2-hour post-glucose load as the one of the criteria for the diagnosis of diabetes. And this OGTT, again, an oral glucose load, an oral anhydrous glucose is given to the patient. So 75 grams usually for non-pregnant adult, 100 grams for pregnant women, and of course 0.75 grams per kilogram body weight for children as long as it should not exceed 275 grams. So how can a person be diagnosed as diabetic? Or how can we say that the patient really has diabetes mellitus? So according to American Diabetes Association, these are the following tests that need to be conducted in order for the patients to be classified as having diabetes mellitus. So we have the fasting plasma glucose, or we can say fasting blood sugar. We also have 2-hour post-glucose challenge using the OGTT. We have the HbA1c and RBS. And we have here the normal values for those tests. And another thing, we have here the classification pre-diabetes. So this pre-diabetes classification is also known as impaired glucose tolerance or impaired fasting glucose. So what do I mean by this one? So you are pre-diabetic if your blood sugar levels are higher as compared to normal values or normal level, but not yet high enough to be diagnosed as diabetes. So meaning to say the values obtained do not fall in this one because this is already diabetic classification. So for the person to be diagnosed as diabetic, the FPG or the FBS should be equal to or greater than 126 milligrams per DL. The 2-hour post-glucose challenge should be greater than or equal to 200 milligrams per DL, just like the RBS with classic signs and symptoms of diabetes mellitus, the polyuria, polydipsia, and polyphagia. And also, for the HbA1c, we have equal to or greater than 6.5%. So those are for the diagnosis of diabetes mellitus. And among the 4 tests, it is the 2-hour GTT using the OGTT, which is considered as the gold standard for diagnosing DM, particularly type 2 diabetes mellitus. However, this test has a limited use for mass screening because it needs fasting and it is a very time-consuming test. And also, some of the studies show that this has poor reproducibility of the result. So that is for the drawbacks of your OGTT. So that ends my discussion. Thank you so much.